who's our first speaker. Celestin recently joined Black Thrive on the employment project, which he will talk to you about in more detail in his presentation. And he's also doing his PhD work looking at how unemployed people are represented in the media and also society more broadly. I think his talk will be about 25 minutes, and after that we will take questions. If you have any questions while he's talking, please enter them in the chat, and then after that, raise your hand if you'd like to talk. Otherwise, we'll just try and sort of capture the questions in the chat. I forgot to mention that we are recording this session so that we can make it more widely available after the talk. So obviously, we're assuming that you're consenting to that by being on the call. Thank you. Okay, over to Celestin.
Cool, thank you. I hope everyone can hear me all right. I'm gonna quickly share my screen and then try my best to hide most of you so I can see the slides. Yeah, thanks for that introduction, Dr. Woodhead. It's great to be here and to talk with you all. I'm going to talk a bit about my PhD research, which is on social psychological kind of explanations of the impacts of unemployment, and then I'll link that directly to the work I'm currently doing with Black Thrive. So my PhD is due to submit in a week or two, so cross your fingers and wish me luck that goes all right. Yeah, so I'll just crack on and get straight into it. So to kind of, in a nutshell, specifically, I'm going to talk about understanding how stigmatization develops in the public sphere, how that common sense, if you will, affects identity and identification, and then in particular, how it affects other people's beliefs about people who are stigmatized. And then linking that to the work with Black Thrive, developing that knowledge in relation to intersectional identities and the nature of intersectional identity, and particularly how unemployment status, health, and race interact. So that's what I'm going to talk about today. But before I do that, I want to alert you a bit to the kind of context of unemployment, which informs in one way or another everything else that I'll say in this talk. So as you all know, the welfare system has been changing dramatically over the last kind of 5 years. Part of those changes are about more and increased conditionality. Other elements are about the kind of sanctions regime. And then at the more macro level, you're thinking about automation, AI, the rise of machines, and so on, and how that will affect labor markets going forward. And now, of course, COVID-19 pandemic and the recession that we will no doubt be facing. And then don't forget, Brexit is still happening at some point, and that may have, at least in the short term, effects on the labour market. So taking this context into account, I've been interested in how our ideas about unemployed people develop, particularly how this knowledge about who unemployed people are and what they do changes over time. One way of understanding that is to kind of qualitatively examine what people say about unemployed people. However, there are some people who have greater power to influence social knowledge than others, in particular, politicians. So in order to investigate this kind of development of social knowledge, I looked at all party leader speeches at national conference since the introduction of Job Seekers Allowance, which was in 1996, until the rollout of universal credit more broadly. So in total, that's 43 different speeches by different leaders of different parties, not just prime ministers, but the ones that didn't make it, didn't win. And that analysis focused on talk about unemployment and unemployed people, and I utilize a kind of thematic inductive approach, concentrating mainly on the semantic content of leader speeches rather than any kind of latent meaning. So I looked for three different themes relating to the way politicians talk about unemployed people. The first one, and the one that's going to become important for the rest of the talk, is othering unemployed people. So categorizing unemployed people as a separate group in society who are different from, and in many ways subordinate to, the rest of society, the rest of the hardworking British people. So, for instance, William Hague in 1999 said he was going to liberate people from a cult. Unemployed people having a different culture to everyone else becomes important to the ways that we understand and talk about. The other ways they talk about unemployment, they talk about structural causes for unemployment. In many cases, that is to kind of aggrandize the achievements of their political party or to debase the achievements of others. So talking about the amount of unemployment, cutting unemployment, or rising unemployment, and so on. And the final way that they talk about unemployment is in enacting policy around unemployment. So they talk about how they will solve problems of unemployment through, for example, job seekers allowance, and now more recently, universal credit, and so on. So all of that, at least to me, is extremely interesting. But if you are like me, you might be thinking, how does that relate to the wider society? Politicians are powerful, but what they say doesn't necessarily translate into common sense or widely shared knowledge. So to solve that issue, we tracked the use of these different frames through the 6 most widely circulated newspapers in the United Kingdom over the same period of time. So we developed a kind of dictionary of terms from the words that politicians use to talk about unemployment. And we searched for those across those 6 most widely shared newspapers over the same time period, so 1996 to 2017-ish. And what we were able to ascertain from that analysis is that this othering frame, this is the darkest line, this othering frame has increased more quickly over time than other ways of talking about unemployment. Indeed, other ways of talking about unemployment seem to either be stagnant or to have declined over the same period. So an alternative way of talking about unemployed people might to say that there is a lot of, there's not enough jobs in the economy and so on. And that would be this kind of economic frame of reference. And that has declined over the same period. So we might conclude from this that explanations from unemployment that focus on so-called culture of unemployment have become more widely shared in society and are increasingly diffused through society. However, again, questions still remain about the extent to which these ideas being widely shared in society affects the way individuals' attitudes and opinions are formed about unemployed people. So again, to solve that problem, we longitudinally gathered British Social Survey attitude data concerning people's attitudes towards employment, unemployment, and the welfare state. And we find that tracking public attitudes over the same period shows that the use of the othering frame increases as attitudes towards unemployed people decrease. So, and that was the case even when we control for the actual unemployment rate, or indeed the more tight measure, which is the claimant count. Overall then, what we do is we support assertions from the framing literature that supposes that the prevalence of and exposure to frames influences the attitudes of citizens towards the object of the frame. In this particular case, leading to more negative attitudes towards the unemployed in the general population. So when politicians seek to frame an issue in specific ways, they must be aware of and consider the possible reactions, motives, and beliefs of the polity. Although it might appear that I've presented this in a kind of direct line from politicians into individual minds, in fact, framing is not a kind of unidirectional relationship between political elites and citizens. Rather, the assumed beliefs of citizens define acceptable and popular frames on issues of political import. So as you can probably tell by now, this led me to more questions. In particular, what is the role of this kind of societally held common sense knowledge on identity processes? And so to explore that question, I conducted a couple of studies which investigate how what others think affects how we see ourselves. So from a kind of theoretical perspective, we might say that it's perceivable that how an individual sees themselves differs from the ways that they believe others perceive them. In the social identity tradition, which is what I kind of come from, members of a group are seen to both define themselves as group members and be defined by others as such. But what happens when an individual doesn't see themselves as part of a group, but others do? So what happens when what I think differs from what I think others think about me? And so to explore that, we ran a survey with some unemployed folks, and we asked them to rate unemployed people on competence, morality, and warmth, or sociability. So these are kind of stereotype content measures which are popular in social psychology. And then we also changed the frame of those questions and asked how most people would rate unemployed people on these dimensions. And in addition to all of that, we asked to what extent they identify as unemployed, which we expect to be very low because being unemployed is a kind of stigmatized social identity. But then we also asked them the extent to which they think other people see them as unemployed. So I know that's all a bit complicated, but we're dealing at the level of knowledge and meta-knowledge. So our knowledge and the knowledge we have about what other people think. And so in each case, and I'll explain this slide a little bit, in each case, unemployed participants rated themselves higher on these stereotype content measures than they perceived that others would rate people who are unemployed. Most importantly, unemployed people thought that others identified them as unemployed more so than they did themselves. And each of these comparisons is kind of significant, p less than 0.05 and so on. And indeed, we constructed a structural equation model which found that meta-identification, so the extent that other people see me as unemployed, actually was the only good predictor of both well-being and social self-esteem, which to me, although I'm clearly biased because I did this research, to me makes a lot of sense. So the extent to which other people see me as unemployed is likely to decrease my self-esteem in social situations. And that's kind of what we find here. So what we learned was that meta-knowledge can be important for well-being of unemployed people and likely stigmatized groups more broadly, particularly when those stigmatized groups are permeable, which is an important characteristic of unemployment. It's a permeable group, so we can leave or we can try to leave. But it's also been suggested that stigmatization and specifically identity threat that arises from stigmatization can affect cognitive performance. Therefore, in an experimental study, we asked participants to think about positive or negative, in the other scenario, impressions that people hold about unemployed people in society and to list those. And then we, again, measured identification and meta-identification. And we got them to do some anagrams, and we were trying to test whether or not there might be a difference in their performance on these anagrams based on their perceptions of how other people see them. And so the only significant predictor of performance on these anagrams was meta-identification. So the extent to which other people see me as unemployed was the thing that predicted their performance on this kind of variable intensity anagram task. So in the study, the extent to which participants thought that other people identify them as unemployed negatively predicted their cognitive performance, which is tentative evidence and certainly tentative, that it's not only about what we think of ourselves, but what we think others think of us that influences stereotype, threat, or the extent to which cognitive performance might be limited because the group that you're a member of is stigmatized. Ultimately, though, stigmatizing common sense that I identified earlier doesn't only affect unemployed people. Okay, it affects the rest of us as well, and the way that we interact with unemployed people. So finally, then, I wanted to test how this socially shared knowledge might impact on recruitment processes. So across 2 experiments, one of which was during lockdown, and that wasn't on purpose, but it just so happened to be the case that one of them was during lockdown. We showed participants who have hiring experience 1 of 2 CVs, and we asked them to rate the likelihood that they would interview and hire the candidate. So in addition, we asked them again about these measures, about how competent they are, how moral they are, and how warm they are. And these 2 CVs, these 2 conditions are exactly the same, except that on one of the CVs, the dates around the most recent employment are different. So you might not be able to see this properly, but both CVs are completely anonymized. These are the actual CVs. And we used a cover story about data protection to avoid questions about why the CVs were anonymized. So to make it slightly clearer exactly what the difference are, this is it. So that's the entire difference between the CVs. And what we found was that the results were quite surprising given the manipulation that I've just shown you. It's basically one word. Across both of the studies, unemployed people were less likely to be interviewed and less likely to be hired. And in general, so this was across 2 studies, and so we did a mini meta-analysis of those studies. And in general, there seems to be a small to medium negative effect on employment-related outcomes of being unemployed. The question then becomes, why is that the case? Why should that be so? And recall that, of course, we measured competence, morality, and warmth, and we found that the relationship between unemployment status and outcomes is fully mediated by the perceived competence of the candidate. What I'm saying here is that by changing that one word on the CV, the candidate was seen as less competent than the employed candidate, and when we take into account that effect, it explains why the unemployed candidate was less likely to be interviewed and less likely to be hired. So what we've learned here is that unemployed people are seen less favorably than equivalent employed candidates. That is because they are seen as less competent than employed candidates. Education, race, gender, etc. cannot be used to explain this difference, since none of them can be inferred from the CV. Remember that the CV was entirely anonymized. So as such, we must conclude that lower competence is assumed directly from employment status. Having said that, then overall, and this is kind of the PhD then in a nutshell, elites and others can shape what we know about groups, so whether they're good or bad. That meta-knowledge then affects us as members of those stigmatized groups in terms of our self-esteem, well-being, and possibly cognitive performance. And those effects are then reinforced when others act upon the negative representations developed in the social milieu. Armed with this knowledge now about unemployment, it brings us to begin to think about how other circumstances and identities might compound these experiences. So at Black Thrive, we're trying to move the dial on employment outcomes for Black people with long-term conditions. And specifically, we do this, we're aiming to slow the progression from one to many long-term conditions via meaningful employment. To enable that, we have a £300,000 pot of funding, of which we have a community working group who make decisions about where that funding goes. And And ultimately, it's a kind of action research project. So we are trying to do something, do some research about the thing that we did, and then change the thing that we did so that it becomes better. And that's ultimately kind of the working model. All of that then is underpinned by community research, and we're working with KCL and the Centre to develop that community research, as well as other partners at TSIP and at PIN. So I'm obviously new to this work. I've recently started. So as you might do with any kind of new academic project, we're kicking off this work with a systematic literature review. And the general argument around that systematic literature review is that there are people with long-term conditions, particularly mental health and learning disabilities, are relatively unlikely to be in work. Being out of work for long periods, of course, decreases the likelihood of getting employment. And both of those things are more extreme if you are racialized as Black. So Black people disproportionately require mental health services. They acquire long-term conditions younger and accrue multiple long-term conditions at a faster rate than others. And if we kind of step back from this, and it's also true that even healthy and highly educated Black folk struggle to find work, particularly when they graduate and so on. Having said that, though, there are many services and programs out there that already exist, and lots of people doing research around this issue, trying to increase meaningful employment for people with long-term conditions. However, given what I've said, given that Black people are overrepresented among the cohort who need these services, the following question kind of becomes relevant to us and to our work. So how effective is employment support for Black people in the UK? So all these employment support services that are out there, how effective are they for Black people in the UK? Following the kind of usual methodology that people use for systematic literature reviews, we did our academic database search. We screened out a lot of those from title and abstract, and then we did a kind of spec in our full text review where we looked specifically at the methodology and the part to ensure that they're actually Black in the study. Once we'd done that, we were down to 17 articles, and after a full text review, half of those are not relevant. So the first thing to say is that there is very little in terms of the available literature to help us answer this question. But from the articles that we did read, that we have put into our final corpus, we see that whiteness is kind of a norm, and other groups are homogenized. So for the most part, if there is a study that includes people who are not white, they are compared between white and non-white. So it's not white and Black and Asian, it's white and non-white, or white and BAME. Of the qualitative research that exists, there is not really a concentration. There's not a race. There's not a lens put on the particular experiences of Black folk. Although we know that there are other issues which come into play when Black people with long-term conditions are seeking employment, not least because of their race and what effect has on their employment out. There's really constant experiences of Black people, although they are sometimes included in other studies. The quant stuff that's out there is generally quite lazy. Even when there are high proportions of Black people in a study, sometimes more than half of the people in the study might be Black, they fail to include race in the analysis, and race is either ignored completely or it's a control in a regression. And then those papers discussing specific employment services or outcomes, we haven't found any that report the outcomes by race. So even if you say this employment service did really well, lots of people got into work, we don't know whether there was a systematic difference between Black people and other people in those studies. So ultimately, it's difficult for us to kind of draw any conclusions, and my view at the moment, and we're still working on this, but my view at the moment is that any research that we do in this project will be the first time the research has ever been done, because no one seems to have cared about the experiences of Black people. although it is the case that they disproportionately require mental health services and so on. And I'll be interested. I'm going to finish now. I'll be interested to hear from others about your experiences in this kind of work, and whether it's the case that we're missing something major, because we have essentially not found anything. So yeah, I'd be interested to hear from people. Before I finish off, always have to, nothing gets done by one person, so I have to shout out to my collaborators. Dr. Ilka Glabs is my supervisor at LSE for the PhD work. Yasmin and I have been working on this systematic literature review along with Leila Kubara at Black Thrive. And then our research partners, the McPim Foundation and TSIP, have been helping us to think about community research and how we involve community researchers. You can get in touch with me on my email address, or you can follow me on Twitter, but I rarely use Twitter, so that's up to you. Good.
Thank you very much. So I think if people have questions, could you just raise a hand and I will just come to you, or obviously feel free to put your questions into the chat box. Does anyone want to kick off with any questions? I think Diana, you've raised your hand. Just unmute yourself, Diana.
Thank you very much for that. I think it brought back memories of social identity theory in the 1980s. I have some points I hope would be helpful. First of all, starting at the end, you said you looked at the peer-reviewed literature and you found this basically absence of mention of race as a cause, race as an outcome, racialized group, full stop. Why didn't you look at grey literature? Why didn't you look at the kinds of literature produced by Kindred Minds Manifesto or J.C. Callaghan and Prem Letravivi? Why didn't you look at the Catch a Fire literature? I think there's quite a lot in the grey literature, and I always, personally, think that just focusing on the peer review literature is not going to tell you anything.
Yeah, funnily enough, we have a rapid review going on separately, which is being run by our partners TSIP and McPin, and their review focuses exclusively on the grey literature. So yeah, so we're covering that. But to be honest, it's I don't know if it's acceptable for academia to ignore Black people, and so that's also part of the question. So it's kind of like saying, why should it be the case that there is no literature on the experiences of Black folk? And I think what this systematic literature review can do is provide a basis for people to say, okay, we need to focus on this other area that seems to have been missed in the academic literature. And I think that's also important. But of course, that's not to deny that work has been done elsewhere. And so that's also important to make sure that we recognize that people have been doing work in other places and to include that as well. Yeah, so thank you for that.
Can I ask a couple more, Charlotte? Or do you want me to stop now?
Yeah, ask one more. There's no other hands up as yet. So
okay, so there's a few. You mentioned social identity theory and the meta thinking of identifying with the group that you're allocated to by other people. But what about in social identity theory? There is an issue of choice. Some people can choose the groups that they're allocated to. They tend to be higher status groups. And so that kind of fits with them. If you're allocated to a group that is dissonant with the way you think about yourself and you don't have a choice, then I think that issue of choice is important. The second thing is about how is this different from self-stigmatization that psychiatrists rabbit on about, because it seems to be you're saying that you don't use the word internalized because you use terms about meta thinking, but it looks to me like what people talk about when they talk about stigma is out there, stigma is in society, people are exposed to it, they begin to think like other people, and they reflect it on themselves. I think it's a bit of a victim blaming stance, but I'll just leave it there.
That's interesting. Perhaps I wasn't clear. I'm actually not saying that people are internalizing the stigma. What I'm saying is that it becomes difficult to engage with others when you think those others see you negatively, and that's really what I mean. So I don't make a claim about whether or not unemployed people see themselves in a negative light, and in fact, the meta study that I did do showed that unemployed people actually see themselves in a more positive light than they think others do. But it's about this question of how others see me. How am I able to go into an interview and pretend to be confident and so on if I think that the people in that interview see me in a negative light because they may know something about my unemployment? So and I'm not super clued up on the psychiatric literature, so I'll have to look into that. But yeah, thank you.
So I have a question. I was just wondering how your findings from your PhD can be used in the Black Thrive project in a way that doesn't sort of, as Diana says, sort of put the onus on people themselves to kind of change their, so yeah, how could your findings be sort of made more relevant to the Black Thrive project, and how can it?
Yeah, great question. And we are thinking about we have this £300,000 pot, and we're thinking about what we can do to do things differently. One of the ways is it important to categorize the people that we work with as unemployed, for example? Is that important? I'm not sure that it is important to categorize them as unemployed. We might say that some of the people that we're working with want to do specific kinds of things, and therefore we create our groups around those specific kinds of things. So whatever that job or whatever that industry is that they want to go into, when we're thinking about peer support and providing community support to people, must we say that you attend this group because you are unemployed, or can we say you attend this group because you want to do something in particular? So I think that's one of the ways, because partly it is the categorization as unemployed, which is limiting. And so rather than change the society's ideas about what unemployed people are, I don't think it's necessary to use unemployment as the vehicle by which you do the support.
Thank you, that's really helpful. So I'm just going to ask Layla to come in because she has a question around the culture of welfare dependency.
Yeah, thanks, Celestin. Great talk and really useful food for thought. So my question around is around, you talked fairly early on about this culture of welfare dependency as one of the othering methods or othering statements, if you like, that senior people make. And what I was curious about really was the distinction between the words themselves and the reality, and what the implications are for the system. And what I mean by that is, not every country has the same, not everywhere has the same welfare system that we have. There are migrants who come to this country who are surprised by the, so that's from working with migrants, that surprised by the welfare system, and who themselves believe it is a culture of dependency until they maybe fall into it themselves for whatever reason. So I suppose I'm quite curious about the thing itself as a construct, or as a something that that Britain has decided to have as a system, versus the way that it's talked about and when it's talked about differently. So what I'm trying to get at here really is that there is, people kind of like it and think it's a good thing to have welfare system, but at the same time it is equally used as a tool, as a way of stigmatizing individuals.
Yeah.
So I guess I'm wondering about that kind of almost contradictory balance in society about, we all love the welfare system, we love the NHS, we love, and of course the NHS is part of that system. And so just what your thoughts are really on the reality of something that we have set up on purpose,
Yeah.
versus choosing to make it a negative thing when it might suit or otherwise. And that is a bit kind of like, to be honest, it is quite, I don't want to use the word mind effing, but that's what I mean, really.
Yeah. It's interesting, you know, and I think that probably could be a whole talk in itself, but there is a long history in British culture of differentiating between different classes of poor people. So you have a deserving poor, a so-called deserving poor, and a so-called undeserving poor. One of the reasons why the welfare state, as it relates to unemployment benefits, often has this kind of trouble, is because the people who claim unemployment benefits are seen as undeserving. And so, whereas if you have an illness or a disability or something and you need to use the NHS, that is seen as being, you are deserving of the support of the rest of society. Whereas being unemployed, particularly being unemployed and not perhaps having any other health condition, is seen as not being deserving. And therefore, that is the area in which, when governments decide it's time to save money or it's time to reduce the state and so on, that is normally the direction that we go in. Having said all that, I don't agree that there is any kind of culture of welfare dependency in this country. You know, the Troubled Families Program and so on was, as far as I'm concerned, built on a pack of lies. So, you know, partly it's also about the state trying to interject in the lives of poor people as well. So there's kind of a lot of different things going on when it comes to why we pick specifically unemployed people on job seekers allowance normally to be the ones that we kind of stigmatize. I haven't answered your question, but it's
just to come back 2 seconds on the culture. I don't think that having a culture of what, I suppose the dependency is more of the problem maybe than the culture part, because in a way part of what I'm saying is that we've set up a system. It's like saying there's a culture of dependency on the NHS or something. I mean, it's like, you know, the fact of it being a culture, I'm not sure is a problem in itself, I guess, partly what I'm saying. We made some choices, we set things up, and so the use, it's a manipulation of the situation and language, I guess, is partly what I'm reflecting on in terms of when it suits. But other times we're really proud that we can put everyone on furlough. Yeah. You know, is that a culture of dependency or not? You know, it just is. We made a choice about what we wanted to do about people in a certain situation.
Yeah.
Thank you. So we've got another question from Rochelle. Did you want to say your question?
Yeah. Gosh, Celestin, what an amazing talk. Just to say, I just thought it was so good. And it reminded me of so much fun stuff that I read when I was in that department. Sort of in particular, some of Caroline Howarth's work around, you know, I'm not Black until somebody else tells me I'm Black, and that kind of stuff. I thought it's really interesting to look at it in this context. And I guess I had one question and one comment. So I guess the comment is, I sort of thought that, I wondered if you could think a little bit about, or if you had thought about critical race theory and sort of how critical race theory thinks about different types of engagement as sort of protective risk factors or protective behaviors for mediating risk that people are exposed to in and around race, and sort of how some of those processes that we talk about and sort of how people identify themselves positively or negatively might manifest in relation to these different types of processes. So the way in which people sort of give in to sort of structural determinism or material determinism, or engage more deeply with race consciousness as acts of protection. It just sort of, that's something I started to think about, and I thought maybe you might find some of that interesting. And then my actual question was about the move of these quite deep sort of processes into the experimental lab, which is something that I often, like, I sort of get these nerves, like I get real nervous about like, putting these things into labs. And I just sort of wondered how, if you felt any of that sort of nuance gets lost in the laboratory, and how you sort of work to maybe mitigate against that. So that's,
yeah, absolutely.
Thank you again. It was really great.
Yeah. Thanks, Rochelle. Yeah, that second question is a good question, and I wrestled with that a lot. But I am generally methodologically agnostic. I think it's strange to develop the research question from the methodology rather than the methodology from the research question. However, the PhD wouldn't have panned out how it had panned out if it was not for a large-scale, deep, qualitative study to begin with. So all of it kind of rests upon that. But certainly, the lab is no substitute for reality. And so I am conscious of that, and conscious of what studies in the lab can tell us about what happens in the real world. So I try to be tentative in kind of what I'm saying about my results and what they might mean, and not to generalize beyond the scope of what ultimately an online experiment can tell us, particularly if there are not many replications of that. So yeah, and I still kind of struggle with this, like where I kind of sit, I suppose, epistemologically. And then on your what you're saying about critical race theory, to be honest, for reasons that I would love for you and I to discuss elsewhere, I never talked about race in my PhD on purpose, and so I'm now bringing myself back into that literature. So we are thinking about, of course, Black Thrive. We are thinking about race, but the particular nuances of how that might manifest itself in this work are not clear to me yet. But those discussions are ongoing, and I'd love to have more discussions about it with you. Yeah.
Of course, you can look me up, no problem.
Thank you, Rochelle. So there's another question from Milena.
So hello, thank you as well from my side. I have enjoyed the talk a lot, and it's really inspiring. I have a question regarding the methods as well, and I just wanted to ask whether you have considered to study other media than newspapers to see how attitudes are formed in this period of time, like social media or radio podcasts or television. So how have you decided, and why have you decided for the newspaper, and what has been your considerations on this topic? Thank you.
Thank you. Yeah, good question. And there are definitely other forms of media that you could use. One of the reasons why we use newspapers is basically because the study is longitudinal in nature, and it's about where can you get records of what has been published, or what kind of mediated communications you can find. So partly it was that. So since the total number of newspaper articles in the study is about 200,000. So we're from 1996 until 2017-ish. So partly it's ease, to be fair. There's an ease around being able to get access to newspapers over that period. Although the second consideration also is around how to analyze it. So you could have radio broadcasts, but then how do you decide which radio broadcasts are the ones which are the most widely circulated, or the ones which are likely to lead to these changes in common sense understandings? So those were kind of the considerations, but with the political speeches are also a form of mediated communication, which I argue in the paper, because they are broadcast. So when a politician speaks to their national party conference, they don't only speak to the national party conference, they speak to the population at large, because they know that this will be broadcasted. But you're absolutely right. And the Twitter stuff and all that kind of thing, I'm kind of into that now. I've got, my Twitter API stuff, so I can get data from there. But of course, Twitter didn't exist in 96. But I mean, yeah, so all of those are interesting and could be used. And I don't think there's any real good reason why you shouldn't use them, unless, you know, it's a longitudinal study or you have some other reason. So yeah.
Thank you. We've got a question from Tessa in the chat that says, Tessa, would be interested in your thoughts on the implications of your findings around the stigma of unemployment in terms of hiring practices in the institutions that we work in. So do you think that we should stop asking about gaps in employment during job applications? I'm always curious about what constitutes an acceptable answer to this question, and whether having a period of unemployment constitutes a black mark on all of somebody's future job applications.
Yeah, so I would say that gaps in employment are a black mark, and I think that may not just be related to unemployment. That can also be related to childcare and that kind of thing. So how do we explain these gaps in employment? And I think if you are unemployed and you don't have a good reason for having a gap in your employment, it's a bad situation for everyone concerned in the interview, partly because you now make clear, or you bring to the surface, you make salient these negative attitudes that we know people hold in society about unemployed people. I had this situation, to be honest, when Layla was interviewing me back in the day, because I had been unemployed. And so when they were asking me about what is this kind of gap on your CV, I had to kind of make stuff up, because, you know, I didn't want to just say, well, you know, I didn't have a job, times were hard, and I didn't have a job and I wasn't able to find a job. So that was difficult. So I'm not sure what the solution is, but I argue in the paper that we may be able to go to a system whereby we remove dates entirely. And I don't know what other people's thoughts on it are, and obviously I don't want to go down a rabbit hole of that conversation, but there's a question about what is the purpose of the dates on the CV. Usually what we want to find out from the CV is how much experience does this person have in some domain. So if I say I've been working in academia for 10 years, how relevant is it whether those 10 years are the last 10 years or the 10 years before that? I'm not sure, and different people and different industries will have different opinions on that. But I do think there is something that could be done around dates of unemployment and so on.
Thank you. So we've got just under 10 minutes left, so I'm going to focus on questions that are coming up, and then people can sort of reply to comments as they go through. So Leah, did you want to say your question?
Yeah, thank you. Great talk, so interesting.
Thank you.
It really reminded me of my dissertation, which was a few years ago, where I focused on our mixed race people recognised in policies, and it kind of ties in with how there is this white and then a non-white group, and you know, Black, Asian, mixed race people, we're all lumped under this one banner. So I guess, my question would be, I really agree with well, I'm mixed race myself, I'm Black and white mix, and I definitely get put under the label of which I look more like. And so I was just wondering, is in your research, would you include the experiences of mixed race people, and I'm talking about the Black and white mix, and that, would you include them under the heading Black, or would you differentiate them?
That is interesting. I hadn't thought about it before, to be honest, which is weird because I'm also mixed race. So in Black Thrive, who we say we are helping or seeking to support are Black people and mixed race people who are mixed with something and Black. And so Yeah, I think there is a scope for that. There's the one issue on the kind of stats side is how many mixed race people are you going to have, and is there enough for you to make any kind of claim about the experiences of mixed race people? But in the qualitative stuff we're doing, and we're doing a lot of interviews right now around COVID, employment, and so on, we cannot repeat the mistakes of the studies that we've seen out there. So we need to be, as long as we have enough people for it to not be kind of identifiable, we should be saying something about the particular experiences of mixed race people if they highlight them, right? Because, you know, some people will highlight that they have a particular experience as mixed race and others may not. And that's interesting in itself. So yeah, I'm definitely going to keep that in the forefront of my mind, actually, because I hadn't thought of that. And I think it's important to think about that and what that means.
Okay, thank you.
Hannah Kiesler, did you want to say your question?
Yeah, thank you very much for a super interesting talk. Lots of questions running through my head at the moment. I was wondering if you could say a bit more about the unemployment project that you're about to start or with Black Thrive, and especially about the methods that you're using. I'm curious about just to learn more about your idea about action research and the community research aspects, just to learn a bit more about what you have thought about these issues and how you're going about it. Okay, thank you.
Yeah, so when we say action research, I mean, I might go back to the kind of Kurt Levine model of action research, but we essentially mean that we are going to fund some projects, okay, in the community to work with people with long-term conditions. And we will collect data from those projects, talk to the people who engage in those projects about their experiences, and of course, look at the outcomes. Did they get into work? Do they feel better about themselves, and so on? So that's one aspect. But in terms of who does the research, and this is where our community researchers come in, we are seeking to train people from the community to both develop the research questions and to collect the data and to analyze that data in whatever form it comes in. So if that means, at the moment, they're doing qualitative interviews with people around COVID-19 and the particular context for Black people around Black Lives Matter and employment prospects and so on. And so that is a qualitative research project where there's no particular research question per se, where we're just trying to understand the experiences of people.
The email I sent last week, it has.
Sorry, could you mute Brian?
Is a file PDF.
There you go. Yeah. So so they're doing qualitative research at the moment. But if it becomes the case, and it will become the case at some point, that we have to do some quantitative research about outcomes and so on, we hope to be able to train them to do that as well, and train them to the level that you know a semi-independent researcher would be at, so they can write their R code and do the analysis themselves, and then write up that research and publish it in whatever format is most sensible, which may include peer-reviewed publications. So that's where we're really going with it, I guess. But I suppose I can't give you specifics about what the research questions will be, because they will develop from both our engagement with the community researchers and the changing context as we go forward.
Oh, this sounds brilliant. Thank you.
Okay, so we've probably got enough time for one more question. There's a few comments in the chat if anyone wants to turn their comment into a question or just to put their comment out there. Just unmute yourself and go ahead.
If there aren't any questions, you can get in touch. I shared my email address and so on. So feel free to get in touch outside of this. I love to chat. So I'll be happy to answer anyone's questions or see how we can collaborate and so on. So yeah.
Sorry, I just had one question, final question. Celestin, thank you so much for your talk. It's really interesting. And I just wanted to pick back up in terms of what Rochelle was talking about, because as you were speaking, I was thinking more of the sociological social psychology literature, and sort of thinking back to Elijah Anderson and Bonnie from Dill. You coming from that perspective, talking about many of these around employment and race, going back to the 70s and 80s, and how much I wondered if you were going to be considering this, because you talked about, working with communities with Black Thrive and labeling people as unemployed. Is the thinking about the other ways in which people work, because in a lot of these conversations and most of the literature, we're only talking about what would be deemed formal employment. Whereas in a lot of communities, and particularly in Black communities, because there are so many limitations and so many barriers to employment, that informal ways of making money and that are, held up and supported by communities, informally, are really important to understand in terms of how people are actually making money and not making assumptions that because they don't see themselves as not making contributions. And so the literature going back all the way, if we think about, a lot of things coming in any segregated community or any community that's been marginalized, maybe rethinking how we think about that, that sort of you're either employed or you're unemployed, because that's usually there. It's more of a question of how are you making money?
Yeah.
Thinking around that in terms of helping communities figure out how collectively they can, benefit their themselves, their families, and their communities. So I'm wondering if that's something that could be taken into consideration.
Yeah, absolutely. And I think it's something that would be interesting for, as we kind of develop our collaboration with KCL, it'll be interesting to continue thinking about those conversations. There's employment and then there's work. So, employment is a contract between you and some employer for time in exchange for money. And then there is the work that people do, which might be something completely different. I suppose what we care about in this project is, number one, that people have enough money in their pocket to live. And that is not often the case when it comes to the welfare benefit system and so on. So improving their kind of financial situation, but then it's also about doing something meaningful that creates social interaction with other people, which we believe would be good for your health. So it's not any old employment. It has to be good, meaningful work, not employment. Good, meaningful work that includes some kind of financial reward, and whatever form that may take, I think it would be beneficial to people regardless. So it doesn't have to be that they have some contract of employment with a formal organization. It could be some other form of income generation or work that they do. Yeah, so I think that's important, and I think that's I just hope we don't kind of lose any of those threads as we are there on the ground day to day trying to get things done. And I think that's the tension that we'll have to consider as we go forward in this project.
Thank you so much. So I'm going to wrap up just because we are a minute over, but just say thank you so much, Celestin, for your presentation. All the chat has been really positive. The next session is on the 9th of September on co-production and mental health research. So please do look out for emails about that. Thank you very much.
Cool. Thank you. See you.